my name is Caitlin Palachek, and I'm with Cook County Health. Thank you for joining us. If you need help with an appointment or have a medical question, you can reach our health system at 312-864-0200. That's 312-864-0200. My guest tonight is Dr. Mike Nelson, and he is an attending physician of the Department of Emergency Medicine at Cook County Health. Thanks for joining us.
Thank you for having me here.
Can you start off by telling us a little bit about yourself?
Sure. I'm an emergency medicine physician at Cook County Health, John H. Stroger Hospital Jr., and I've also worked in medical toxicology and addiction medicine as well too. I also work with the Illinois Poison Control Center to help for people that have had chemical exposures or poisonings or overdoses.
Okay. And so everyone at home is, I'm sure, aware that as of January 1st, marijuana will be legal to use and sell in the state of Illinois. So that is going to be our topic for this evening. Let's start with the basics. Can you talk about what marijuana is and how it's used?
Yeah, well, marijuana is a plant. It's the common name for the plant cannabis, which also has different subspecies. Like the common one is cannabis sativa. There's also cannabis indica, and a few other species as well too. But people will use this plant for multiple intents and purposes, and it can be used by multiple different routes, including smoking it, vaporizing it, edible forms, and even kind of creating an oil and extracts that people can heat the oil or combine that into other types of products like a wax or things that they'll call like dabbing.
Okay. And can you talk about the difference between recreational marijuana and medicinal marijuana?
Well, the first thing is intent, of course. So recreational marijuana, the intent is for the pleasurable effects of marijuana to get high, so to speak, or even for relaxation purposes that some people will use it for. Medical marijuana, you're trying to treat a condition or a disease that's there. Multiple different conditions have been studied for it, although some of the evidence is variable in terms of its efficacy for medical marijuana. It's still a growing, expanding field, but we have seen some benefit for people with intractable seizures, as well as potentially managing some individuals' pain or other diseases like PTSD. And then there's multiple neurologic diseases as well too that it's approved for. But again, clearly the intent is different for somebody using it recreationally versus medicinally. Still, we're learning and growing more about the medical use of marijuana kind of every day as time goes on, and it's still a growing science right now.
And how long has the medicinal side of marijuana been legal for?
It depends on what state you're looking at. Still, multiple states haven't even legalized medicinal marijuana. So each kind of state and region is variable based on that. So, but over really the past 10 to 15 years, we've kind of grown that medical marijuana side of things. And as we've clearly seen from the public perception over about the past 5 to 6 years, more states have been legalizing it for recreational use, leading with Colorado and Washington.
Okay, good to know. And what determines how marijuana affects an individual?
That's a variable response from person to person. So it's not quite yes, no in terms of the way in which somebody will respond to it. And there's the individual genetic factors, the route of use, as well as the concentration of THC, which is the active component of marijuana, the psychoactive component, otherwise known as tetrahydrocannabinol. And then there's also CBD, and there's multiple various cannabinoids that are out there that affect your body. So for one, it depends on the substance you're ingesting or inhaling or smoking or vaporizing or whatever route you're using. And then what the components of the THC to CBD are, how frequently you're using it as well too, versus if it's one time versus you're using 10 times, just same as if you drink 1 shot versus 10 shots of alcohol, it affects you differently from each amount. And then again, each individual person might respond differently for underlying genetic factors, underlying psychosocial factors that are there as well too.
Okay, so with that said, is it possible for a person to become addicted to marijuana?
Absolutely, absolutely. And it truly is, I'd like to back up a little bit though. When we talk about addiction, a lot of people have the misperception that if you are tolerant to something that you are also addicted to it. So I like to define the terms tolerance, dependence, and addiction. So tolerance means that you need to take more of that said substance in order to achieve the same effect. Again, if you have 2 glasses of alcohol before you get buzzed, then over time you need 3 to get that same effect, then you need 4 to get that same effect. If you become dependent on it, that if you get rid of that substance, you wind up going into withdrawal that's there. Addiction means that you go outside of societal norms to obtain said substance. You wind up having a set of circumstances that lead to these negative consequences over time. That, for instance, like let's say you get your weekly paycheck and then you go and spend it all on gambling and you're not buying food or paying your rent, and then you do that over and over again. Well, clearly then you'd have a gambling addiction, and everyone could see that. So for cannabis or marijuana, individuals could spend all their money, all their time trying to obtain said substance, and neglect all the other things in life, like their personal relationships, their hobbies, the things that made them who they were. And they'll do that just to obtain the substance. And it can occur with anything. Again, the classic stuff we're dealing with right now is opioids all over the media, but we've had issues with substances for generations.
That's a great segue with opioids. So if someone is addicted to marijuana, is it possible that this could lead to addiction of other drugs?
That's always hotly debated, whether or not marijuana is a gateway drug. The evidence is clear that people that have substance abuse have often started with marijuana as one of those things. But plenty of people that use marijuana don't go on to use, quote unquote, harder substances like opioids or heroin. We do know that people, as they started younger in life, that they're more likely to go on to use additional substances over time. This has to do with a lot of the way in which substances work on the brain. Many substances will stimulate the dopamine reward pathways in the brain, which are feel-good pathways, the pathways that give us pleasure and enjoyment. And then the younger that we start that, it does change the conformation of the brain, the configuration of the brain, and changes those reward pathways in the brain, that you're more likely to want to try and seek additional substances to stimulate those pathways again.
Have you ever seen a case like that?
From marijuana? Yes, I've seen plenty of individuals that have essentially given up their hobbies, teenagers, individuals in high school that were participating in sports and then started smoking marijuana, decided to start smoking every day and stopped playing their sports. Their grades went down and other kind of things. And they're brought in by concerned parents or other individuals that have noticed this change in their behavior over time.
Right. And what type of health risks are associated with marijuana use? So
there's both our acute and our chronic risks that occur. Acute, obviously, are the intoxicating effect of the substance. People wind up developing an elevated heart rate, the classic bloodshot or injected sclera, the whites of their eyes. And then it can lead to paranoid reactions, acute psychosis, impaired coordination, impaired decision-making. And then you can just imagine, though, the secondary effects that occur from that. If you have impaired decision-making and you get behind the wheel of a car, then potentially you can get into a car accident, which then can kill you or kill somebody else. Mm-hmm. Or you have a fall because your coordination's impaired and you hit your head, and you wind up either suffering a broken neck or an intracranial bleed or just a simple cut or laceration. So then there are all the secondary consequences from there. Smoke itself also has complications. So any combustion of carbonaceous materials, like lighting the marijuana plant and buds, the smoke inhalation can cause cough, increased phlegm, lower your ability to fight off respiratory infections, such as that people can get pneumonia and other kind of things. And then you can have the second-hand effects of smoke as well too, where people can have increased reactive airway disease such as asthma. And there's also the chronic effects of marijuana. And people use it over time. It will impair their memory. It can impair their coordination. It can impair their motivation as well too. And then, of course, then people can become addicted, and all the secondary complications that occur from addiction.
Right. That makes sense. So, would it be safe for a breastfeeding mother to smoke marijuana?
No.
No?
No. So THC, or the active component of marijuana, is secreted into breast milk. And then From there, if the child is exposed to the THC, it potentially can impair brain development. It's very difficult to get excellent studies because you couldn't randomize young children to getting exposed to THC and to follow them over time to truly know that. But we do know it's excreted in breast milk. And then we do also know that individuals that have had THC exposure, potentially their brain won't form or develop the same as another individual over time.
Okay, so with that said, you're saying that it's not safe for a pregnant woman to have smoke marijuana either, correct?
As well too, because the tetrahydrocannabinol is secreted and is transferred across the placenta into the developing fetus. And as the brain is growing and developing, any of those chemical injuries potentially will impair that. So there have been studies that have shown that infants and fetuses exposed to tetrahydrocannabinol will have decreased fetal weight, preterm birth, increased risk for stillbirth, as well as potential developmental issues later on in life after birth, such as attention deficit disorder, cognitive delays, potential decreased IQ as well.
So you talked a little bit about infants and babies having secondhand smoke. What about teenagers, kids in high school that are smoking weed?
Yeah, so there's...
Like, how does that affect their brain?
Oh yeah, so the brain is still continuing to grow and develop until our mid-20s, somewhere around the age of 24, 25, 26, before the brain is fully formed and fully done growing. And the main part of the brain that is still very active are our dopamine reward pathways, our risk-taking pathways, and the part that develops a little bit later is something we call our prefrontal cortex. That's our executive function of the brain, the part of the brain that says, hey, this is a bad idea, I probably shouldn't do this. So when we are exposed to these chemicals and substances earlier in life, it does, again, impair those cognitive development features that occur, and then potentially increases our risk over time that our response to other chemicals will be more enhanced, such as our response to an opioid or nicotine or alcohol later in life will be more amplified, and that will be more at risk for developing, again, a substance use problem. Additionally, it can impair our learning and our coordination over time, as well as it can impair our long-term cognitive executive function.
Right, that's helpful to know.
Yeah.
Is it possible for someone to overdose on marijuana or have a bad reaction or trip?
Yes. So when we do start with defining the term overdose, though. Generally, overdose means that you've consumed a particular amount of a substance that has put you at significant life-threatening risk. So now there has never been, from a primary marijuana case, a significant overdose that you will have a direct life-threatening event that would happen.
Okay.
But then there have been the cases where you become so intoxicated that you have the secondary complications, just like, let's say, alcohol, for instance, becomes so inebriated that you get behind the wheel of a car and you get in a fatal motor vehicle collision. Same thing can happen, too, from marijuana. But the direct chemical substance of it would not cause a fatal overdose. Where alcohol, again, if you keep increasing the amount of alcohol you've taken, you can become so inebriated that it will impair your respiratory centers and you'll stop breathing. Or you'll vomit and you'll aspirate the vomit into your lungs, which will impair your breathing, and you won't get oxygen and your brain won't get oxygen and you'll die from that. So, but people can definitely have a bad reaction or a bad trip, so to speak, to marijuana, which is classically displayed in multiple movies that are out there. And because of that, people will have such paranoid or psychotic events that will happen. And I myself have seen multiple people, particularly young individuals, that are trying to push the limits of THC concentration, get so psychotic that they need to be restrained, sometimes need to be intubated for their own protection, and admitted to intensive care units, and to allow the substance to metabolize and be worn out of their system.
Okay. And going back to alcohol, what are the effects of mixing marijuana with alcohol or tobacco or a different type of drug, speed, something?
You're going to get the dual effect of both occurring.
Okay, so what does that mean?
So let's say you take alcohol and marijuana. So both are inebriating, and both will impair coordination and reaction time. If you're using both of them together and then you're trying to perform a higher task, such as operating heavy machinery or a vehicle, your reaction times are going to be impaired that much more. You're going to be that much more likely to have an accident or an untoward effect from that. And then additionally, for healthcare providers, it will provide a mixed picture where it might make it more difficult to actually interpret what's going on. So you can imagine if you start throwing multiple substances in the mix, like a cocaine with a marijuana, with PCP, with an opioid, that it'd be very difficult for a healthcare provider to be able to treat you at the time if you are so inebriated that you're unable to care for yourself.
Right. And does it make any... So marijuana is technically a downer, right, would you say?
It is. It has more sedative effects.
Okay. Like it's,
that will occur,
okay.
where people are more relaxed.
Yeah.
But it also does some stimulatory effects too, where
Yeah.
we'll see an elevated heart rate. We'll also see dilated pupils.
Oh, looks like we have a caller. Caller, go ahead.
Hi.
Hi.
So I've been watching, and I read and seen stories that traffic accidents increase in states where marijuana is legal. Now, I'm not exactly a smoker myself, but some of my friends are, and I just wanted to know if it would be advisable for me to get into the car with a friend if they've been smoking, or would smoking somehow make them more likely to have an accident? How would that work?
Yeah. So marijuana, again, does impair your coordination and your reaction times. And one of the important things to know about marijuana is that it isn't the same as alcohol, where it's what we call water soluble and it excreted over time in a very predictable pattern. It deposits in your fat tissues. It can take a long time to wear out of your system. So in states like Colorado, for instance, that have legalized marijuana, we have seen an increase in motor vehicle collisions. And an interesting, there was actually a review done by Roberts this year in the Western Journal of Emergency Medicine that looked at the Colorado impact over time. And from 2002 up to about 2010, the rate of fatal motor vehicle collisions dropped from like 650 down to 400. And then right around 2010 to 2012, where they had legalized medical marijuana and then recreational marijuana in 2014, fatal motor vehicle collisions started climbing up to the same base that they were in 2002. And if we look nationally, motor vehicle collision rates have dropped steadily over time over the past 20 years. So we did see that increase in multiple motor vehicle collisions as well as fatal motor vehicle collision accidents in Colorado. Additionally, we've seen an increase in emergency department hospitalizations, the need for ongoing hospitalization with that, as well as suicides that have occurred that people have had positive toxicology screens for marijuana in those states as well too.
Oh, wow. Okay.
Do you have
Thank
any other questions?
No, I think that, well, slightly. I just wanted to know then, I probably shouldn't get in the car with someone right before they've smoked. I should maybe, because I know you say that it's less predictable, but maybe I should wait a little while before I then take that chance.
I think that's a very wise thought process and decision there for sure. Especially the same with, like, think about alcohol. Like if somebody had 2 or 3 drinks and you can see that they're impaired, you would make the sound decision to not get behind or not get in the car with them. So marijuana does a very similar thing. The hard part is we don't quite have set limits in terms of saying, well, this amount causes this degree of impairment. It's still an evolving field right now where we can say that, this degree of amount in your blood then causes this amount of impairment that you're more likely to get at an accident.
Okay, I appreciate that. Thank you.
Thank
No
you.
problem. Thank you.
Speaking of doing things while you're high, how long are people high for?
Yeah. So again, depends. So it depends on how frequent of a user they are. Is it a one-time use or not? So in general, for a person that uses once, like just one time, nothing else, and depending on the route of use. So if they smoke the substance or vaporize it, they'll have an immediate onset of symptoms within within minutes, generally, 5 to 10 minutes or so, or even less, depending on the concentration. That will last for about 1 to 4 hours or so. But their coordination time can be impaired beyond that. There was a study in 1991 where they took some airline pilots, and at the time, they allowed them to smoke standard marijuana, which is like 3 to 5% THC concentrations. They first had them in a flight simulator before. They measured all their reaction times, coordinations. They had them smoke marijuana. Then 24 hours later, they had them back in the flight simulator, and all the reaction times were impaired. Their coordination was impaired, even 24 hours later. So they'll have the acute physiologic effects, meaning the elevated heart rate, the relaxation effect for about 3-4 hours or so after their ingestion, but their coordination times and their cognitive decision making was still impaired 24 hours later. So when you're talking about the effect, it's always important to define what effect we're talking about. So it's an interesting dynamic, though. If you're a chronic user, somebody who smokes every single day, we've seen delayed reaction times, coordination times, even weeks after their last use, because again, marijuana is lipophilic. It deposits in your fat tissues. So a person who's smoking every day, it can often take them 28 to 30 days after their last use of marijuana for them to fully excrete all the active components out of their body, where they'll still have positive urine drug screens a month later after their last use.
That seems sort of contradictory to the fact that it's also being used in a medicinal way if they're shown as cognitive disturbances at the same time. But.
Right, and again, it depends on the intent and the purpose of use, where you're saying somebody's cancer pain is so bad that it's not being controlled with our current medicines, and that the risk-benefit analysis is better for this individual to be using marijuana to try and help control their pain. Or this person has such severe seizure disorder that it's not controlled with our typical medications, that again, their quality of life is better with the marijuana than without it. Or somebody that has such severe PTSD that they're just not functional, that they can't go out of their house, and that this has actually helped them.
Yeah, I've read that people are helped with their anxiety by marijuana opposed to Zoloft or whatever is on the market because of just the long-lasting effects of those. Is there a difference between smoking marijuana and eating an edible?
Absolutely. So first is the time of onset.
Okay.
So smoking a substance, you have inhalation, it goes into your bloodstream within seconds to minutes. So you start having effects very quickly. An edible has to go into your gut. Your intestines and stomach have to break the substance down. Then you have to absorb it through your liver and metabolize it through your liver, and then it goes into your bloodstream. So you can often have a delayed effect from the time of ingestion. On average, for almost any pill, even a pain medicine or an antibiotic or anything else, about 30 to 60 minutes from the time of ingestion. So some individuals will take an edible, and then human beings being somewhat impatient, 15 minutes later say, I'm not feeling anything, and then take another. And then say, I'm still not feeling anything, and then take another 15 minutes later. Then all of a sudden,
it all hits.
And they've had a huge dose. And they're more impaired than they would have been for that. And there's a concept that's been known since the 1400s by a guy named Paracelsus, that it is not the substance that makes a poison. It is the dose that makes the poison. And that makes a lot of sense, again, because everyone can relate to alcohol. It's such a ubiquitous substance. One shot, okay, maybe we feel the effect of it, feel buzzed. 10 shots, we're passed out in the corner. You increase the dose, you increase the toxicity.
That makes sense. And so then obviously if you have 2 edibles opposed to half an edible, you'll be impaired longer, and the effects of it, like the next day, will be stronger than it would, like the effects of impairment.
And additionally, too, when people are mixing marijuana with food components, it's not quite a solvent where the chemical is dissolved equally across the entire substance. It's more of a mixture where parts of the chemicals will be distributed unevenly throughout there. So while one person can eat a corner of a brownie and the other person will have the other one, and this person feels fine and this person has significant effects, that's because of the mixture rather than the solution.
Right. And it could also have to do with a person's weight, right?
Of course. Body weight, individual characteristics, genetic variances, whether or not they become tolerant to the substance or not, all of which are factors at play.
Makes sense. Well, thank you so much. This was very informative, and I hope that everyone at home learned something today. Do you have anything else you want to add before we wrap?
Yeah, I just say, of course, it's an individual choice, an individual decision. But like everything in medicine in the world, you start low and you go slow if you're choosing to use marijuana, especially with the recent legalization of it, until you know how it affects you over time and how you're going to respond to it.
All right, well, thank you very much. And thank you to everyone. Have a good evening.